of reporters are taking part in pool reporting, social distancing. It's really great to see the collaboration in making sure we're getting out factual information. Commissioner Malcolm is going to update us, but I think it's important to note we're going and had announced a little earlier today we had 19 fatalities. This has been Minnesota's deadliest day of COVID-19 deaths, and also 154 new infections in a testing rate that was staying relatively similar. So this is appears to be we're climbing that slope. These have been, and this is the day of the highest infections and highest fatalities. So we extend our sympathies. Every one of those is a life story. Everyone is a brother, sister, spouse, grandparent. So extends our deepest condolences. But I'm glad to be here today with, the other day when Doug Baker was with us, he mentioned when you have a really tough problem, one of the management truisms is you smother it with talent. I can tell you today, we are smothering this issue of testing with, I would argue, talent better than any place on the planet. And the collaboration that we're going to announce today and the work that's been done to put Minnesota at the forefront of making sure we can test and then just as importantly trace, and then equally important, isolate those cases so that we can get on top of hotspots, so that we can understand the extent of the infections, and so we can do what we've been talking about from the beginning of this. As I asked folks to stay home, as we made incredibly hard choices around our lifestyles and our families, the plan was relatively simple sounding, much more complicated to carry out. The first was to make sure that we had the resources at our hospitals, the personal protective equipment, the ventilators, the rooms, and the capacity to build out.
Together in incredibly short time, the specifics of how we can start this as fast as possible. So we're calling this the Phase 1 agreement to implement this strategy. This is an agreement between the major hospital systems in the state to all sign on to these priority goals and to work collectively, not just individually, but as part of a cohesive whole, with the need for central lab capacity to support and augment the current capacity that exists in the health systems. Mayo Clinic and the University of Minnesota came together just in recent days to agree to collaborate to create several critical things. First, this central lab capacity to accommodate the expanded testing volumes that the state needs. Second, building what we're referring to as a virtual command center in coordination with the health systems and the Minnesota Department of Health to manage the daily flow of testing to assure that these increasing goals are met. And this partnership also brings us the capacity to partner with the state on cutting-edge analytics and research to inform, again, the proper and best and highest use of these tests to achieve both the clinical and the population health goals, but also the ways in which this real-world learning that we're doing, this applied research capability that we will have to inform the best testing strategies, the best containment strategies, and ideally feeding into the search for treatment as well as prevention. So it's a big deal. So what we are doing today, we'll be issuing another health alert message out to the health alert network statewide, is to set clear direction to the health systems, and I know the CEOs have already begun to do this, that we're removing that any confusion about who needs to be tested and saying every symptomatic Minnesotan must be tested as soon as possible. We want to stress intensive testing of vulnerable populations, including, as the governor has said, and as you have seen in our data, Minnesotans living in congregate settings and those experiencing homelessness, staff that serve these vulnerable severe disease, and also workforce for critical infrastructure. Since day one, the governor's been talking about the importance of the daycare infrastructure and of those who are working in critical sectors. And one of the things I'm most excited about is the opportunity to work in this really cohesive way with these partners to be able to more quickly respond to the hot spots that we're seeing come up. That's just going to be critical to both controlling the spread of the disease, but also supporting those specific populations and learning best how to do that. So what we have just executed to build this mechanism and to start hitting these rapidly increasing testing goals is being funded. This first phase, which is a fast-moving phase, we're talking about a few weeks here, to get this built and to ramp up the testing volumes to where we're talking about. We're funding that with a $36 million withdrawal from the COVID-19 fund, which the legislature thankfully gave us a great deal of flexibility to be able to move fast on opportunities like this when they present themselves. But we will also immediately begin partnering with the legislature on how we will follow this science, how we will use this capacity that's being built very quickly in order to really roll out the broader, longer-term plan for Minnesota. That is going to take a lot more resources and a very close partnership with the legislature to figure out how best to deploy Minnesota's resources, as well as to take the best use of the federal funding that we hope and believe is on the way. So I couldn't be more grateful to these partners and prouder of our state's collective approach to this, to say we're going to do this together. We're going to maximize what our healthcare systems can do. We're going to take fullest advantage of the unique assets that we have here in Minnesota through Mayo and the university and through our strong public health system. So with that, Governor, I will turn it back to you.
Dr. Tola. Thank you, Commissioner.
Good afternoon, everyone. This is a good day. This is a glorious day. It's an Earth Day 2020. This is one for the ages, because out of all that globe that has been suffering under this pandemic, there's one piece of it, and that is the state of Minnesota that I'm the most proud of. This is why, because we have a leadership in the governor, in the commissioner, Malcolm, Commissioner France, and others that understand the enormous power of science in making decisions on societal basis. So that ability to understand what is essential but invisible, as Little Princess in Saint-Exupéry, that is what's behind our effective ability to respond to this pandemic. So thank you, Governor, Commissioners. Thank you for the leadership in the state. Almost equally, I am grateful to President Gabel. President Gabel is a visionary leader of the University of Minnesota, and she represents the land-grant university, which is the first dictum of which is to serve Minnesotans, serve the community, and really deliver on what we need to do in the state of Minnesota for the patients, for their families, and for everybody there. So whom I represent here are the people that are behind that science that has changed medicine and epidemiology, for that matter, from magic 200 years ago to actually something you can do something about. So we are no longer to be seen in this state as victims of this pandemic, but rather vectors. You can deconstruct that. You can do something about this. And all these prognostications, all these Twitter storms, all these, social media events. I'm not big on social media, but my teenagers tell me. It is the one reason that I can think of why the prognostication is important is to change it. Do something about it. And that's why Minnesota is different than others. That's why Minnesota and its university is seen as a information and action hub, national and internationally, because we have been able, under the President Gabel's leadership, to actually deconstruct that problem and represent, the science behind it. So what is the science? The science started from the, I'm going to talk about the testing because that's why we are here today. It started from some of our investigators to looking at that virus at a very, very enlarged way. And so the virus looks like a chew toy of your dog. It has these little spikes, and with the technology called cryo-electron microscopy, they've been able, at the veterinary medicine and the medical school, we were able to understand the interaction between the cell, which is the epithelial cell in the lung, and the virus itself. From that, we have taken that would be like beginning of March or end of February. We've taken that, and my Center for Immunology at the university has taken that and developed a antibody testing, serologic, testing, whereby we can detect the response to that chew toy of your dog. literally speaking, the spike protein of that. And from that, we have taken it to the lab. And from that, we have scaled it up to the point that the commissioner, the governor, everybody else can use it. Because we are here ultimately as a land-grant university to serve Minnesotans, everyone. As you said, vulnerable, people that cannot, practice social distancing, everyone across the greater Minnesota. And that's why we do this. You mentioned supply chains. Very importantly, if you can deconstruct the testing, being that the polymerase chain reaction for the molecular, being then the serology, if you can really take the individual modules out of the equation, you are independent. So the beauty of the testing at the University of Minnesota is that most of it is not dependent on the regular supply chains. It is, in fact, something that, I have a PhD. I came here 30 years ago to get a PhD in molecular biology. You can actually develop your test and you are independent. So you own your future. So we own the not just the mission of the university, but we own that gravity of the epidemic for the Minnesotans. The second group that I represent here are the clinicians. I think you and the governor mentioned it at the beginning. This is personal. This is 2,000 people is a statistic. If this is your grandmother, this is not a statistic. This is something that's gonna change you and me and others for the rest of your life. So this is important because these clinicians that I represent, and with my partner James Hereford on the mHealth Fairview, we have this COVID-19 hospital in Bethesda, not that distant from here. That is where these selfless, utterly exhausted people practice not heroism. It looks like heroism for where you stand, because it's so distant. From their standpoint, it's an act of decency. I am doing my job. That's what they do. And my work, my service is to them, with my teams, is to support them with the protective equipment, with the ventilators, with the swabs, with the antibody testing, with the serology testing. That is why the University of Minnesota teams, we have started 2 months ago to build new lines of the masks, new lines of the low-cost ventilators, new lines of the molecular testing and serology testing, this COVID-19 hospital, research that goes behind. This is a different disease, by the way, than influenza. This is really different than the other coronaviruses. These are these small clots that go to the lung, go to the brain, go everywhere, to the kidneys. This is different, and we need that science to really, be able to do that. So what you need to know is we trained for this. This is, I'm an intensive care unit doctor. I'm a bone marrow transplant physician. I deal with people that are very, very sick. And we trained for this. We built for this. We have 6 health science schools at the University of Minnesota, with College of Science and Engineering, College of Design, mHealth Fairview, and of course, my dear friends and colleagues at Mayo Clinic are in that partnership together. So what we really are here to do is to provide that service to the greater Minnesota, not just metro. People should get excellent health care, not because they live close to a big hospital or they have a good paycheck. No, everybody. The access to reasonable medical care is, in my opinion, a fundamental human right. It is something, that should be allowed to everyone. And that's why I'm proud of this state. And we should move that inevitable initial emotion, which is that one of fear and pity, that all of us are exposed to, in the realm of the pandemic, to a scientific, moral, almost symbolic responsibility for the sickness of our Minnesotans. So I'm here for that, and thank you very much.
Thank you, Dr. Toller.
Governor.
Dr. Maurice from the Mayo Clinic. Thank you. Thanks, Dr. Toller.
Well, first of all, I just want to thank you, Governor Walsh, for your leadership, and Commissioner Malcolm. As a person who's raised his family in Minnesota, I just want to say how incredibly proud I am to be a member of the state and humbled to have such great partnerships and so many good colleagues around the state to work with. And at Mayo Clinic, we have really had the opportunity to be at the forefront of this in terms of a testing perspective since the early days of the crisis. And so to date, we now have done 120,000 molecular tests for COVID in the Rochester facility and also in our Arizona and Florida facilities. And in addition, we've done 30,000 just for Minnesotans. And today, we can do about 7,500 molecular tests and over 20,000 serologic tests in our laboratories. Again, since the early days of this hitting Minnesota, we've been working with the other great healthcare systems in the state, the other great providers, to see what we could do to make that capacity that we have in Rochester and at Mayo available to the other providers and people in the state, and also been very grateful for working with other state leaders and Governor Walsh and other state leaders to make that capacity available through the Department of Health as well. We have helped with some of the backlog issues there. And going forward, we really are going to be focused on not just building the capacity in Rochester and in our Mayo Clinic facilities, but very much invested in helping the entire state, all of the healthcare systems, get access to and the capability to do the testing that they need to do to safely take care of all of our neighbors here in the state of Minnesota. So that's really why I'm so proud of this collaborative effort. It's more than just the University of Minnesota and Mayo. It really is all of the healthcare providers in the state really growing the capabilities they need to take care of all of us and keep us safe. Because of the size of our laboratory operations in Rochester, we are also privileged to have strong relationships with a lot of industry leaders outside of the lab, those who provide the equipment, such as Roche and others, Thermo Fisher. We will be working hard to make that relationship that we have at Mayo Clinic to benefit all Minnesotans by helping with the supply chain issues, which have been so vexing. To know that someone needs to be tested and to not be able to get something like a nasal swab is really disappointing for all of us, and really something that as Minnesotans we should make sure does not happen again. And Mayo Clinic will do whatever we can to make sure that that is the case. Also, I mean, it's often not known outside of Rochester, but we do testing for patients around the country and around the world. We did 25 million tests in Rochester last year alone. We want to make sure that that infrastructure that can provide safe and reliable testing to anyone that sends it to us, typically within 24 hours, is really focused on the state. We have been prioritizing state needs since the inception of this. We will continue to do so. Really want to leverage what we have there to, number one, restore public confidence in their safety. I mean, that's really job number one for healthcare right now for Minnesotans, is for people to feel safe, feel like they understand this pandemic. Without knowledge, there's only fear. So we will continue to leverage all the resources that we have in collaboration with our partners to make sure that we can tackle this problem as a state together. And also, we will continue to innovate at the university, throughout the state, at Mayo. We'll continue to innovate to find better ways to make the diagnosis, to detect COVID, which is so important. And so we'll make those innovations available to all Minnesotans through this partnership as well, which is really exciting. And last but not least, the question, of course, is how do we get back on the path to normalcy, whatever normalcy looks like as we come through this. Clearly, different therapeutic options beyond social distancing is going to be an important part of that. Again, places like the University of Minnesota Mayo Clinic will have the opportunity to lead some of these efforts. As an example, we're one of the site leaders for the National Anti-Plasma Program, which can be used as an early treatment, has been used in many other infectious outbreaks in the past, and we want to make that available here in this country. And we're really committed to taking those tools as we develop them and making sure they don't just benefit people in Rochester or people in Eau Claire or one of our health system sites, but to make sure that they benefit all Minnesotans through this program. And that's why I'm just so delighted to be part of it, and so proud and so appreciative of leadership bringing this together, and on the open-mindedness of all the leaders in the state to really come together in a very rapid fashion to help us address collectively a problem that we can't overcome by ourselves.
Thank you, Dr.
So thank you.
Andrea,
Thank you.
thanks so much.
As CEO at Health Partners, where we serve 1.2 million patients and 1.8 million health plan members, I applaud and thank you, Governor, for your leadership. We have needed to advance a vision for statewide COVID-19 testing, and so I want to applaud and thank you, thank the commissioners who are here today, and our partners across the healthcare community. In recent weeks, social distancing has helped us slow the spread of disease and given us the time we need to be ready. Looking forward, expanding testing and contact tracing is a necessary building block to help us work towards reopening Minnesota. We need this public-private partnership to expand COVID-19 testing and to implement stronger tracing and isolation processes. It's crucial for several reasons. It'll help us prevent the spread of disease and keep each other healthy and safe. Secondly, it will expand access to care for patients without COVID-19 who may be delaying care that they need today. Third, we'll also be able to expand testing while we continue to do the tests that we need to protect our doctors, our nurses, and care teams. For example, when a caregiver gets a negative test result, they can get back to caring for patients instead of being quarantined for 14 days. A negative test